Hey guys, Adrienne here. Thank you so much for coming back to my channel. Today's video is a update on my recovery from FAI hip surgery. It is now officially 3.5 weeks since my big operation, which was on my right hip for a labral tear. So they repaired my labrum, and I also had 2 bone impingements. One was on the cam bone, which is part of the femur, and another one was a pincer bone impingement. So both of those extra growths of bone were causing rubbing on the hip joint, and over time it was just not smooth enough, the ball and socket, to allow the labrum to move freely. It basically was getting caught on the impingement, and over time just started to shred up like cheese. So after a year of digging for answers as to why I was having such terrible lower back pain, I also had hip numbness, and I just had really bad pain inside my glutes and into my thigh. I went on this endless journey for answers, which started with chiropractic care. I went to one orthopedic doctor who sent me for a x-ray of my back. I had an x-ray of my hip. I also had an MRI of my lower back because they truly believed that this was lower back pain, which something that's very common is that FAI hip issues do mimic lower back pain. So most of the time you start treating for lower back issues, and lo and behold, you actually have a hip issue happening. I also had a hip arthogram, which is where they inject a dye into the hip joint and then perform an MRI to determine if the labrum is torn or not. So I had multiple tests done. I visited multiple doctors. This took about 9 to 10 months to diagnose, and basically at the end of all of that, I was at the point where they thought I had an issue with my lower back. They wanted to start doing injections into my spine, and I said it's time to take a pause because I really don't believe this is a back issue at all. So I kept complaining to my husband of my symptoms. My hip would fall asleep when I would lay in bed at night. It always felt like I was laying on almost like a heating pad. I had shooting pains down my butt into my leg. I had issues with driving. I had issues with sitting for long periods of time. I completely gave up weight training for months at a time because my squats and everything just really hurt. And eventually, John, my husband, said, why don't you go for a second opinion before you even touch your back? Because I don't believe what you have is a back issue. It sounds a lot like a hip issue. Now, why would I take his advice? Well, my husband's had many orthopedic surgeries before. He's had 2 shoulder surgeries in his left arm, 2 in his right. He also had a FAI hip surgery as well. He had a bone spur and a labral tear. And so anytime I told him how I was feeling, he would say, Adrienne, I really think you should just keep searching for answers in your hip, because everything that you're saying is exactly what I felt. And he actually wound up getting FAI hip surgery years ago. So lo and behold, I went to another doctor for a second opinion. I went to Tri-County Orthopedic. I met with Dr. Hunt, and we reviewed my MRIs together in person in the office, and there it was. In clear view, I had a labral tear, I had a pincer bone impingement, and he gave me some suggestions on what I could do as opposed to surgery: physical therapy, chiropractic, which I had already done. And basically at this point, this was, I want to say, 11 months into my journey, and I was just sick and tired of it. So I said, look, if you think that surgery is going to help and just get me over the hump and get onto a life being pain-free and get into rehab and recovery, then I'm all for it. And so I scheduled surgery. My surgery was on June 13th. It was a Wednesday, and I was definitely very nervous and very scared because I had never had any surgery done before that was related to an injury, and I wasn't quite sure if I did this it would make things better or would it possibly make things worse. And it's a pretty intensive surgery. lasted almost 2 hours. You are under general anesthesia. You have anywhere from 4 weeks to 3 months that you could possibly be on crutches. But at that point, I just decided that I really needed to get to the bottom of things and just take the leap of faith and go in and have the surgery done. So I did. So now here I am. It is 3.5 weeks post-surgery. As you can see, I'm in the car now and I'm able to drive. I am really happy and thankful and glad that my recovery has been nothing short of amazing. I will definitely say that FAI hip surgery is a roller coaster of recovery, that is for sure. You can have days where things feel fantastic, and then all of a sudden you can have a week where the pain is somewhere different and it's uncomfortable and you're sore and you're back on your crutches and you're wondering, did I just do something to hurt my recovery? Is this supposed to feel worse? Because I thought I was doing so much better. But it's definitely ebbs and flows as you go through your recovery from hip surgery. So the surgery lasted about 2 hours. I woke up and stayed for an additional 2 hours at the surgery center. It was done in an outpatient location, which was part of the Morristown Hospital. I got home probably around 5 o'clock and was already in my walker. I decided to use a walker for the first couple of days because it was a lot more stable, and the crutches kept bumping into my incision area, which was covered with a lot of padding, but it just was very difficult to move around all of the padding with the crutches, so I did use a walker for the first couple of days. The first 2 days were a lot of sleeping, a lot of soreness, a lot of body adjusting. I was very tired. I was very bloated from lots of fluids that they were pumping me with. I tried as best as I could to get up a lot and move to prevent blood clots in the legs, which can be definitely a scary side effect because you did just have a major surgery in your lower extremities and you're sitting a lot. So I was on a prophylactic care of aspirin. I also was taking Celebrex, and I'm still taking Celebrex in the morning and night, which is an anti-inflammatory, which really helps to reduce the inflammation in the leg and hip joint. I will definitely say that I did use pain medication for the first week because it was really difficult to sleep, to move, to get comfortable at nighttime, to get comfortable sleeping on a couch. So definitely those are there for you to feel comfortable, and the best thing you can do is sleep and rest and relax so that your body can do all the repairing and healing that it needs to do in those very critical first couple days and first weeks. I slept on my couch for the first 2.5 weeks after surgery. Laying flat was really challenging, and it was just so much easier to be propped up on my couch, to get up really easily, to have a table tray with all of my juices and medicines and books and remote controls. So I definitely recommend getting a table tray and having a really comfortable area on the couch to just post up for the first 2 weeks. Spent a lot of time watching Netflix, spent a lot of time just working from home. Thankfully, I had the ability to work from home for the first 3 weeks. So for the first 3 days after surgery, I did not log on at all. I kind of just tried to sleep as much as possible. And then that following Monday after surgery, I just opened up my laptop and started doing work and was completely fine to do that. I had 2 incisions, which is actually really interesting because I know some people have had 3 or 4 with hip orthoscopic surgery. I only had 2, so thank you to my doctor, because now I only have to battle with 2 scars in the summertime when I'm wearing a bathing suit, but otherwise the incisions are pretty unnoticeable under a pair of like Nike Pro shorts or regular shorts. They're pretty high up and you can't see them. The stitches were non-dissolvable, which means I did have to go back to the doctor to have them removed. I had them removed 2 weeks after my surgery. 2 really quick snips of the sutures and they were out, and at that point I no longer had to protect the sutures or the incisions with anything other than scar treatments or ointment or vitamin E oil or aloe vera. I was unable to shower after surgery for 72 hours. So my surgery was on Wednesday, and I was able to remove that big bulky dressing on Friday and take a shower. So I wasn't unbathed and stinky for a week. It was only really 2 days that I couldn't take a shower. Highly also recommend getting yourself a shower stool, because I did find that that was really comfortable to take a shower. I would literally sit in the shower on the stool. I had a rotating one so I can spin back and forth to face the water or face the wall, and I bought that on Amazon. I will also link that below, but that was a lifesaver, and I used that probably for the first 3 weeks because it was just comfortable to sit in the shower and not put a whole lot of pressure on my leg after surgery. As far as crutches protocol, I was on crutches for 2.5 weeks, almost 3. By week 2, I felt comfortable enough to use one crutch around the house, and I was not comfortable walking without a crutch at all until about after week 3. I, at this point, no longer use crutches, and they are in the closet, so I don't need those anymore, thank God, because they definitely get very aggravating and annoying. Every doctor is different. Some doctors keep you on crutches for a month, 2 months. All depends on you, how you were before surgery, how much you had done inside, and just how you're recovering. So don't be alarmed if you are on crutches a lot longer than I was. It just is based on a per person, per case basis. But yeah, I definitely was off of the crutches by week 3, so that was very, very exciting. Other than that, at my almost 1 month FAI post-surgery, I am feeling really good. I am back in the gym. I am doing a lot of stationary bike to keep that hip warm. I am doing PT 2 times a week, which is really great to just kind of do some push and pull actions to get those muscles firing again. I am also doing a lot with the resistance bands in my home gym just to get some flexibility in the hip again and build up some strength in that flexor. Everything that I'm doing is approved by my physical therapist and by my doctor, so definitely make sure to heed their warnings and just do the things that they say that you are able to do at that point. Right now, really what I'm battling with in week 3 and in week 4 is still some numbness on the side of my leg that is expected, and a lot of the nerves that were probably cut and moved around in there while I was having the surgery are just kind of like repairing and refiring again. I also have a little bit of what feels like bruising under the skin, almost like if you bang your leg into your side table, that kind of like, ooh, bruising, swelling, soreness under the skin. I feel like I have that now, and again, I think that's just because so much was done in there with those tools that the muscles are repairing as well. I do feel a little bit of scar tissue under my incisions, so almost like little hard pieces of skin, and that can be massaged out very gently as I put vitamin E oil on those scars overnight. Otherwise, the CPM machine was gone after week 2, so that was great. The continuous passive motion machine, which definitely felt really good and kept that muscle and those flexors moving. I would do that for 1 to 2 hours twice a day in those first 2 weeks. The ice machine, loved that. I kept that for 3 weeks and would ice a couple of times a day, especially after physical therapy. Trying to think of anything else. Otherwise, I've been in great spirits. I go to the gym every day and do the bike. That makes me feel like I'm at least still staying active and fit. I've avoided eating any kind of inflammatory foods. So my diet is pescatarian. I eat a lot of seafood, a lot of high fiber vegetables, lots of healthy oils, nuts, seeds. I do also like to eat berries to get in antioxidants and fiber. Cottage cheese, yeah, very clean diet, and I've avoided a lot of sugary foods and a lot of spicy foods and a lot of inflammatory foods, because after surgery you want to battle inflammation, so I've been kind to my body in that sense as well. But otherwise, I'm really excited to report that 1 month out, I'm feeling amazing. It's everything I expected to feel and better. So yeah, I guess that's my summary post FAI surgery. If you guys have any questions, feel free to throw them down below. I'd be happy to answer anything now that I'm a month out of surgery. I'm also happy to give recommendations of my doctor and the products that I used and the things that I bought leading up to surgery. So thank you guys for watching. I hope this was helpful. I'm going to go head out now and run some errands. So excited to drive again and just be normal. So thanks so much for watching, and I'll see you guys very soon in another video.